Let's grab our heaviest Theraband, and our ball will lie back for footwork, lying supine, elevating the pelvis, making sure that the ball is under your tailbone, and you can create some lumbar extension. So you can take the pointer fingers to the bones, the bony protrusions on your hips, and guide them down for lumbar extension. Keep that extension, bracing your abs, and lift your dominant leg into the air. We'll place the heavy Theraband around the metatarsals, especially the bone of your big toe, and extend that leg into the air. You'll dorsiflex your foot, and we're going to work on inversion from the ankle joint, not from the knee. Make sure you're not working from the knee, so you're taking the foot in towards the face, pressing the bone of the big toe into the band, and then back to parallel. No movement in the leg, no movement in the knee. There's only movement in the foot from the ankle joint. Check in with your breath. Are you holding it? Use the breath. Exhale to bring the foot in towards the face from the ankle joint, and inhale back to parallel. Exhale in towards the face and inhale parallel. Go ahead and switch sides, setting up, knowing that the goal of this exercise is not only to open the calf and hamstring, but to work on your feet. The feet are so important because they affect the whole chain. Your back pain is linked to what your feet are doing and how you're using your feet. So there is a lot of benefits. There are a lot of benefits of using your feet correctly. So go ahead and focus on getting that bone of the big toe to press into the band as you move into inversion and back to parallel. Inversion to parallel. Core is engaged. Using your breath. Good. We'll come out of that slowly, making our way up to stand, grabbing a 3-pound weight and coming into a tightrope stance. If the tightrope stance feels very precarious and you feel unable to balance, take it to a wider staggered leg stance. The weight is in the same hand as your front foot. Feet are nice and parallel. Soft bend in the knees. Focus on the weight in the bones of your big toes and take the hand of the same hand as your back leg behind your head. We're going to take lateral flexion here, stretching over and adding the bottom arm as the lever as we did with our knees on the roller. Hold it here. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale and brace the abs coming back up to center. Make sure your torso stays square to the wall in front of you. Your collarbone is wide, your shoulders are plugged down your back, your chin is retracted. We're doing 2 full inhales and exhales, bracing the abs on the exhale, breathing laterally on the inhale, thinking about the sternum reaching towards the back body. Inhale through the nose, brace the abs to support this external oblique work. We really want to strengthen the outer obliques as well as the QL to bring the body upright and protect the back. Your last set on this side, remembering the bones of the big toes are heavy. This will help stabilize you so you don't fall to the side you're bending towards. The knees should be softly bent and tracking over the second and third metatarsals, ideally if you're really pressing into the bones of your big toes to combat that supination. Adding the bottom arm as that lever to increase the load. When you finish this last set, let's switch your staggered stance, switching the weight into the other hand and beginning on the other side. Remembering to inhale, prepare, and exhale, pulling the abdominal wall in, bracing those abs as if you're being punched in the gut. It's also important to think about your tailbone reaching back a bit so you have some lumbar extension, so you're not tucking your butt under. Even though you're bending your knees, you're still keeping some lumbar extension. You're bracing those abs every time you add that long lever, increasing the load on the external obliques. If the neck is straining, turn your head and look down on the diagonal. Retract your chin. Lots of options to recruit the correct muscles and not overwork overactive muscles. Finish up your last set. And once you're finished, you can grab your lightest loop band to place around your ankles and your heaviest Theraband to hold behind your back, pulling out on the band to retract your shoulder blade anchor, your serratus anterior. We'll use a wall like a bar so that if we need to grab it, since we're doing some balance work here, we have it for safety purposes. We're going to be traveling in the frontal plane, stepping to balance. So you'll step towards the wall onto a parallel foot, heavying the bone of the big toe, bringing the other leg into knee flexion. Immediately, keeping a soft bend in the supporting knee, pulling out on the band to retract the serratus anterior, nodding your chin in to engage the front of the neck, keeping your focus eye level or higher, your ribs closed, your tailbone pointing back so that you have lumbar extension. And let's step back. We'll repeat this step to balance. So I don't want you putting the foot down as you step towards the wall. I want you lifting that outside leg up immediately. You can dorsiflex the foot to run energy through the foot. And just make sure that you're not pressing your ribcage forward, that you're thinking about the heart reaching towards the back body to close those ribs and engage the abdominals. One more breath. And let's bring it to the other side. Setting up, stepping to balance. Find it, soft bend in the supporting knee, weight in the bone of the big toe, pulling out on the band, palms are forward, shoulders down the back, collarbone wide, chin retracted. One more inhale and exhale. And let's go ahead and repeat, stepping to balance onto a parallel leg, soft bend in the supporting knee, knee flexion, tailbone reaching away, lumbar extension, shoulder blades retracted, upper back extension, ribs soft, collarbone wide. We'll take the bands and set them to the side, coming to the wall. We'll be taking a T-pec stretch, bringing one arm out to a T and rotating around. Let's use our breath. Inhale, pull the abs in, brace them. Exhale, twist a little further. Inhale, abs in, brace. Exhale, twist. Good. Moving on the breath with control of the core and a soft bend in the knees, brace and twist. Chin retracted, back of neck long. Inhale, abs in, brace, and twist. We'll go ahead and switch sides. Soft bend in the knees. Inhale, pull the abs in, brace, exhale, twist. Inhale, abs in, brace, exhale, twist. One more. Inhale, abs in, brace, and exhale, twist. Turn to face the wall, stepping your dominant leg back. Nice and parallel, look over the shoulder, drive the hips forward as you drive the heel down into a postural calf stretch. We'll be here for a minute, so I really want you to think about your form so that you maximize the stretch. Lengthen out the crown of the head, keep your focus up eye level or a little higher. Collarbone stays wide, heart reaches towards the back ribs, so that your rib cage isn't pushing forward. Your hips are pressing towards the wall, keeping them even. Make sure there's not one hiking up. Driving the heel down into the floor to stretch that gastrocnemius, a posturally tight muscle. Check in with your breathing. Inhale, abs in, brace. Drive the heel as you drive the hips forward. Heel drives down. Inhale, abs in, lift up on the muscles that stop your stream of pee. Hold that lift. Fog a mirror with your exhale. Go ahead and switch sides, starting with the legs hip distance apart and parallel. Stepping the foot back, making sure the foot stayed parallel. You're bending that front knee, driving the hips towards the wall, lifting the abdominals in and up, keeping the collarbone wide, chin retracted. Let's breathe. Inhale, abs in, lift up on the muscles that stop your stream of pee. Hold that lift as you fog a mirror with the exhale. So don't drop that lift to the pelvic floor until you've finished your entire exhale. So the abs stay in until then. Then you can inhale, thinking about breathing into your rib cage like an opera singer, pulling the abs in, lifting in and up. Drive the heel down as the hips go forward as you exhale. Good job.